Let's go back to the basics, out of the trauma world for a second, and talk about the most common cause that someone in the United States of America is going to die, and that is from a heart attack. So what is a heart attack? Well, this is, everyone knows my favorite drawing here. This is your heart, the aorta, and the great vessels coming off. So the first thing that comes off of the aorta here, though, is going to be your coronary vessels, okay? So at its core, coronary artery disease is when plaque builds up on the coronary vessels that supply the heart muscle, the pump, with oxygen. So when we don't have any oxygen delivery, that causes tissue ischemia and death. And when you break the pump, that's cardiogenic shock. That's a form of shock, and that's how you die. So ways to fix this are PCI, which is a percutaneous coronary intervention here. So we would put a stent, our cardiology, interventional cardiology friends would put a stent here. And then the issue becomes if you have what we call triple vessel disease, so all the vessels here are blocked, then you would need what's called a CABG. So this is a coronary artery bypass graft, to where you actually have to use a graft and skip over the lesions, okay? But this is less invasive because we can do a stent through a access in the groin of the femoral artery, go up and over the arch of the aorta like this, and deploy that stent. Whereas a CABG is an actual surgery that a cardiothoracic surgeon performs, which requires a median sternotomy, and then they have to harvest vein grafts to jump over these lesions. But this is the most common cause of death in the United States, and these are the most common ways we deal with it. Any of my cardiology colleagues or CT surgery colleagues, please feel free to chime in and join. But I wanted to go back to the basics on a very common topic, obviously.